Listen, I fear that we have lost the plot. Somewhere along the way, healthcare became less about taking care of people and more about arguing who's more important. That is scary. My name's Kat, I'm a PA, and I'm here to tell you why I stopped posting about being a PA so much on here. I mean, who am I kidding? I still talk about it all the time. Here's a little PSA. If you're in healthcare, or you're interested in going in healthcare, while we're busy fighting in comment sections and joking about future colleagues, patients are waiting months to get into primary care. Do you know that millions of patients, millions of people in America alone, do not have access to primary care or do not have a primary care clinician? They're driving hours to find specialists, they're going to the emergency room for like basic care, simply because they literally cannot get care anywhere else. That's the crisis. Not that there's too many people who want to take care of patients, like what a good problem to have. So here's my advice for anyone who wants to start a career in healthcare. Whether you're going to be a physician, a PA, an NP, a respiratory therapist, physical therapist, environmental service worker, like literally anyone else, here it is. Start respecting your colleagues now. Not when you get accepted to be a medical student, not when you graduate, not after you start rotations as a PA or an NP, not after residency, not when you finally have the title that you've worked so hard for. Now. Because one day, that PA that you're criticizing online might be the only one helping manage your clinic. And that nurse who didn't go to medical school, she might actually catch a medication error before it even reaches your patient. Environmental service worker is helping prevent hospital-acquired infections. And the resident may become the physician you trust one day with your family. Or your supervising physician. Nobody succeeds in healthcare alone. Like, let's get that all straight. Before anyone twists my words, this is not about blurring roles. Every profession has a scope of practice, and we should all practice within that education and training. It all just comes down to respect. Healthcare does not need bigger egos. It doesn't need, my profession's better than your profession. You're not a doctor, you're a PA, like you're just a nurse, you're an MA. It really just needs stronger teams because we are fighting the wrong battle, you guys. Until primary care physicians get paid what they deserve, there is always going to be a shortage of primary care. And obviously that's a conversation for another day. So for the greater good of the patient, for the greater good of healthcare, let's all work together because we all know who we're really fighting. And that's the insurance companies. Cheers.